This segment of DelmarvaLife is sponsored by Delmarva Dental Services.
You know, when you're a kid, losing a tooth is kind of exciting because you get to wait for the tooth fairy to leave a little something for you under the pillow. But when you're an adult, losing a tooth is not so great.
Oh no, but there are of course different reasons that occurs. Fortunately though, there are solutions. The team at Delmarva Dental Services can hook folks up with single, partial, or complete dentures. And as we learned from DelmarvaLife's Katie Zarilli, even though there'll be an adjustment for many folks, it'll be worth it.
A crew that's committed to keeping you smiling. That's who you'll find when you step inside Delmarva Dental Services in Salisbury. Dr. Jessica Harrison says sometimes that means folks get single, partial, or full dentures.
There's multiple reasons why somebody needs to replace a tooth or why we lose a tooth.
The first reason being a large cavity.
So a really big area of decay that renders the tooth not restorable.
Reason number 2, periodontal disease.
We've got the bone loss, which causes mobility of the tooth, and then ultimately we can lose that tooth because of the mobility of it.
Lastly, the cost of replacement could simply be too much. When it comes to dentures, Delmarva Dental Services caters to what patients need.
If you are replacing one or maybe even two teeth, you can get what we call a Nesbit, and that can be made out of a couple different materials depending on the patient's choice. It can be one that doesn't have any metal in it, or it could have a little bit of metal to it to attach to the adjacent teeth of the missing tooth.
Dr. Harrison says this is a quick process that's usually 2 appointments.
The other type of denture would be a partial denture, which can also be made of different materials, and that would replace more than a single tooth, and typically it would replace one on each side or multiple on each side.
A partial denture takes between 2 and 5 appointments, she says. And then, of course, there's the option of a complete denture. That takes about 4 to 5 visits.
Our first typically 2 visits are the impression appointment. The first appointment would be the preliminary impression, where we use typically a stock tray to take an impression, and that gets sent to the lab. The lab will make a what we call custom tray, and that custom tray is specifically fit to the patient. It's more detailed. The impression material that we use captures more detail, and from that the lab will make a bite block or a acrylic base of a denture, and they'll put a wax rim on top of the denture, and the patient will come back and we will make some adjustments to that wax rim to allow the patient to close how they typically close down. There's some measurements that go into that as well.
That then gets sent back to the lab, which, by the way, is local.
The lab will then set the teeth in those blocks of wax, and then the patient will come back again for what we call a wax try-in, and they will be able to see what the teeth look like, the color, the shape that they chose previously. So they're kind of part of that process of finding out, dictating what they want out of the denture. So they will make those decisions. They'll see what it gets to look like. They'll try it in.
If everything's all set, it's off to the lab one more time.
For the lab to process that denture. The patient will come back, they will get the dentures. Usually in a day, 2 days, the patient will need to come back for a denture adjustment because they will probably have some sore spots.
Dr. Harrison says it's crucial for folks to continue to return for checkups as well as take proper care of their dentures at home.
They will store them typically in a container. They can use a little bit of cleaning solution in there and let them sit in there. Brush them with a denture brush, with a denture cleaner. You should not use toothpaste because that can actually scratch the denture and leave tiny pores in there for bacteria to get in.
She says sometimes it happens that folks who have a partial denture end up needing a complete denture.
So we make that transition where they can still keep the teeth, and we can take the impression and start that impression process for the complete denture, get to the very end before delivery of the complete denture, and take the rest of those teeth out and then deliver the denture. That is called an immediate denture.
And more often than not, immediate dentures require realignments.
They might notice that the denture is a little bit loose or it's falling out, and we'll simply kind of remove a little material from the inside of that denture, put a little material in there, impression material, send that back to the lab, and they'll add material to kind of fill that space in.
Yes, in some cases the process is longer, but it's worth it when it's life-changing.
A lot of times folks are so happy that they're able to smile again and function again, because everybody likes to eat and smile, and so we're happy that we can be a part of that.
And so you can know and trust that when you're smiling, this squad is too.
Dr. Harrison adds that a lower denture can be a little bit more difficult to get used to because it moves when you eat and talk. But again, it's worth it. Although dentures have pretty much stayed the same,
Right.
the shape of them, they've come technologically, they've come ahead.
Long ways.
Long ways.
Long ways.